Top 7 vitamins to strengthen your legs. Prevent leg cramps in seniors as we grow older. Our legs carry the burden of age. They support our daily movements, balance, and independence. Unfortunately, seniors often face issues like leg weakness, cramps, muscle pain, and fatigue. These problems may result from poor circulation, lack of exercise, dehydration, or most importantly vitamin and mineral deficiencies. The good news: the right vitamins and nutrients can strengthen your legs, improve mobility, and reduce painful cramps. Let us explore the top 7 vitamins every senior should consider to keep their legs strong and healthy. 1. Vitamin D, the bone and muscle protector. Vitamin D is essential for bone strength and muscle function. Without enough vitamin D, seniors may face weak bones, increased risk of fractures, and constant muscle aches. Why it matters: vitamin D helps absorb calcium, keeping bones strong and preventing osteoporosis. It also improves muscle contraction, reducing the risk of cramps. Sources: sunlight is the best natural source. Foods like fortified milk, salmon, tuna, and egg yolks also provide vitamin D deficiency signs. Bone pain, fatigue, muscle weakness, and frequent cramps. Tip: seniors often need supplements since natural sun exposure decreases with age. Ask your doctor about a daily vitamin D supplement. 2. Vitamin B12, the nerve and energy booster. Vitamin B12 plays a vital role in nerve health, red blood cell production, and energy. Low B12 levels can lead to numbness, tingling in the legs, and poor circulation, all of which may cause cramps. Why it matters: healthy nerves send proper signals to leg muscles, preventing spasms and weakness. B12 also prevents anemia, which can cause fatigue and heavy legs. Sources: meat, fish, dairy products, fortified cereals. Deficiency signs: tingling in legs, unsteady walking, memory issues, weakness. Tip: since B12 absorption decreases with age, many seniors benefit from B12 injections or high-dose supplements. 3. Vitamin C, the circulation and healing vitamin. Vitamin C isn't just for immunity, it also helps maintain healthy blood vessels and muscles. Good circulation is key to preventing cramps and leg pain. Why it matters: vitamin C supports collagen production, essential for strong tendons and ligaments in the legs. It also boosts circulation, reducing the risk of painful cramps. Sources: citrus fruits, oranges, lemons, bell peppers, strawberries, broccoli. Deficiency signs: poor wound healing, frequent bruising, weak joints, and leg cramps. Tip: a daily intake of fresh fruits and vegetables rich in vitamin C can make a noticeable difference in leg health. 4. Vitamin E, the circulation enhancer. Vitamin E is a powerful antioxidant that supports blood flow and muscle repair. Poor circulation in seniors often leads to leg cramps, numbness, and weakness. Why it matters: by improving oxygen supply to the muscles. Vitamin E helps reduce nighttime leg cramps and fatigue. Sources: nuts, seeds, spinach, sunflower oil, and avocado. Deficiency signs: muscle weakness, leg cramps, and balance issues. Tip: vitamin E also helps protect cells from damage caused by aging, making it a double benefit for seniors. 5. Vitamin B6, the muscle function regulator. Vitamin B6 is crucial for nerve communication and protein metabolism. It plays a direct role in how muscles contract and relax, which can prevent cramps. Why it matters: it helps create neurotransmitters, which carry signals between nerves and muscles in the legs. Sources: bananas, chicken, turkey, potatoes, whole grains. Deficiency signs: tingling, irritability, confusion, and painful cramps. Tip: seniors who take multiple medications should monitor B6 levels, as certain drugs can lower vitamin B6 in the body. 6. Vitamin K, the bone strengthener. Vitamin K is often overlooked, but it's extremely important for bone health and circulation. Weak bones and poor clotting increase the risk of falls and injuries in seniors. Why it matters: vitamin K works with calcium and vitamin D to keep bones strong. It also supports proper blood clotting, reducing bruising and bleeding risks. Sources: leafy greens like kale, spinach, broccoli, and Brussels sprouts. Deficiency signs: easy bruising, weak bones, and delayed healing. Tip: seniors taking blood-thinning medications should consult their doctor before increasing vitamin K intake. 7. Magnesium, the cramp fighter bonus mineral. Though technically a mineral, not a vitamin, magnesium is critical in preventing leg cramps. It supports muscle relaxation and nerve function. Why it matters: magnesium deficiency is a leading cause of muscle spasms, restless legs, and nighttime cramps. Sources: almonds, cashews, pumpkin seeds, dark chocolate, spinach. Deficiency signs: muscle twitching, cramps, irregular heartbeat, fatigue. Tip: many seniors find magnesium supplements or magnesium-rich snacks effective in reducing cramps. Additional lifestyle tips for stronger legs. Vitamins work best when combined with healthy habits. Here's how seniors can maximize leg strength and prevent cramps. Stay hydrated. Dehydration is a major cause of cramps. Drink enough water daily. Stretch regularly. Gentle stretching before bed helps relax leg muscles. Exercise, walking, yoga, and light strength training build endurance and circulation. Massage and warm baths improve blood flow and relax stiff muscles. Balanced diet. Combine vitamins with proteins and healthy carbs for energy. Final thoughts: leg weakness and cramps don't have to be a normal part of aging. With the right combination of vitamins D, B12, Ce, B6, K, and magnesium, seniors can enjoy stronger legs, fewer cramps, and better mobility. Remember, always consult a healthcare provider before starting supplements, especially if you're on medication. A personalized plan ensures you get the right balance for your health needs. Strong, healthy legs mean independence, mobility, and a better quality of life for seniors. With proper nutrition and care, you can stay active and pain-free well into your golden years.